Greetings and welcome to Cardiac Anatomy and Physiology. We're going to talk about pieces and parts and how they work. People die from cardiac disease. Coronary artery disease and coronary vascular disease is one of the biggest killers of Americans because we love cheeseburgers. Just can't help that cholesterol and those clots building in your arteries. And those clots have deadly consequences. There are a couple strategies about public education. So trying to mitigate the risk factors and the possible risk factors. But doggone it, all this good food and being lazy is just too fun. But we can help prevent things. We can quit smoking, monitor our blood pressure and cholesterol, control our eating, which will help with the diabetes mellitus. And of course, we can exercise, make that heart a little stronger. Possible risk factors. Hey, take it easy, doggone it. You don't have to be that type A personality and need things done right now, right now. So just chill out. Think to yourself right now, what are some signs and symptoms of a heart attack? You know from your EMT basic class, and probably from some public service announcements or billboards around your town. And just remember, preventive medicine is the best kind of medicine. First, we're going to talk about the pieces and parts, which is the anatomy, and then we'll talk about how it works, and that's the physiology. The anatomy of the heart. The size of each person's heart is the size of their fist. So go ahead and squeeze your hand and take a look at your fist. And it sits right below that breastbone in the center of the mediastinum. The base, which is the top of the heart, is the base, the wide part, is at the level of the second rib. And then the apex of this cardiac triangle is right here. That wonderful location, fifth intercostal space, mid clavicular line. So fifth ICS, MCL. The apex or the apical pulse or the point of maximum impulse is also this location. And when you're hooking up your 12 lead, V4 goes right here, fifth intercostal space, midclavicular line, the apex of the heart. All right, next is the tissue layers from inside to out. On the inside, we have the endocardium. Endocardium. It doesn't absorb any blood. It just helps move it around the heart with that pumping action. Next is the myocardium, that muscle layer of the heart. Sort of looks like that. Atriums, ventricles, and hey, looks like a pretty cruddy heart, but it is one. Then you've got the pericardium. It's the protective sac, and that protective sac is broken down into two layers. The visceral, sort of like the pleura in your lungs, you got a visceral and parietal pleura in your lungs. Well, you have it around your heart too. The visceral layer is your epicardium, which goes right on top of the heart muscle itself. Then you have a layer of pericardial fluid, 25 cc's of straw-like fluid. And then you have the parietal or the fibrous sac with this protective tissue. So that pericardial sac protects the heart. All right, in your heart you have 4 chambers. The blue blood coming from your vena cava go to your right atrium. Then it goes through to your right ventricles and then to the lungs to get oxygenated. When it comes back from the lungs, it is red. And into that left atrium, going to that left ventricle, and then to the aorta and the rest of the body. There's a septum that separates these chambers. So we've got the ventricular septum, and on further up is the intraatrial septum. Know these four chambers and the septum. You'll see it on a hands-on anatomy test. All right, now we're going to talk about the valves. And these are some interesting pictures here, so try to visualize. The atrioventricular valves go between the right and left atriums into the right and left ventricles. The tricuspid valve is on the right side, tricuspid, right side. There are three leaves of the tricuspid valve. Then you have the mitral valve, or the bicuspid valve, between the left atrium and left ventricle. So, memory jogger, to keep the tricuspid and the bicuspid or mitral valve straight in the order of blood flow, is you have to try it before you buy it. The tricuspid valve is on the right side, the bicuspid valve is on the left side. So far, so good. That's the atrioventricular valves. Then, moving from the right ventricle to the lungs, you have the pulmonic valve. Moving from the right ventricle to the lungs, you have the pulmonic valve. Pulmonary goes to the lungs. Then you've got the aortic valve, goes from the left ventricle to the aorta. Let's keep it simple. So you should not get tricked up with those. Then some other things that make these valve works. Muscles. Sun's out, guns out. You got to have muscles to function. These muscles are on the inside in that endocardium layer, or where those papillary muscles are. And then you've got the chordae tendineae. The chordae tendineae are your heartstrings. Sitting on the front porch swing, strumming your heartstrings, and those are the chordae tendineae, strumming that chord. They look like guitar strings. So remember those important things for the inside function of the heart. All right, we can listen to the sounds of these valves in a couple locations. Remember when we talked about auscultation of the chest cavity, we talked about the PMI. And that PMI, or that point of maximum impulse, is right here at that fifth intercostal space, midclavicular line. Then we just slide on over in that fifth intercostal space to the left sternal border to this little green spot right here. And that's LUB. And that's the atrioventricular valves, the AV valves, and basically the spot for the tricuspid valve. Remember, we want to try it before we buy it. And then we move on over from PMI and S1 up to S2. S2 is the second intercostal space, right sternal border, and that's the DUB. It's the location of the semilunar valves. So, and right in this spot, right sternal border, is the aortic valve. If you move to the left sternal border, and this little blue spot, that's the pulmonic valve. So, PMI, S1, S2, aortic valve, and the pulmonic valve. That's where your LUB dubs come from, and you can listen to them while auscultating the lung, chest wall. Certain disease processes give your heart extra tones. These tones can be heard best at the fifth intercostal space, midclavicular line, on the left side. So we're still right over here at that apex of the heart. The first one is S3. It's due to early diastolic filling, volume overload, CHF, congestive heart failure. Your heart is so full that it's starting to fill up even quicker than normal. It sounds like Kentucky. You see this area, we got lub-dub-dee, lub-dub-dee, Kentucky, Kentucky. Got the rhythm, and you'll hear that best at fifth intercostal space, midclavicular line. The next one is S4. It's a late diastolic. If you look at this picture right here, it looks like an early systolic, but the books say late diastolic sound. It's due to uncontrolled hypertension and right-sided stenosis, or hardening of the arteries. S4 sounds like Tennessee, Tennessee. So we got Tennessee, Tennessee, Tennessee. Where S3 was lub-dub-dee, lub-dub-dee. S4 is Tennessee, Tennessee. So the more you listen to your patient's heart sounds in clinicals, the better you'll get at hearing abnormal sounds like S3 and S4. All right, let's talk about blood flow through the heart. If you're on Mix, you can click on the link, the blood flow link, and watch an old episode of Happy Days. Most of your kids are too young for Happy Days, but it's a good song about the blood flow through the heart. If you're on YouTube watching this, hey, copy and paste the YouTube link into a new browser and enjoy the tune. Blood enters the heart through the superior and inferior vena cava and goes into the right atrium. It moves through that right atrium through the tricuspid valve. You got to try it before you buy it. Through the tricuspid valve into the right ventricle. Then it moves through the pulmonic semilunar valve into the lungs. It gets oxygenated in the lungs and comes back through the pulmonary veins, because veins bring blood back to the heart. So from the left atrium, it moves through the mitral or bicuspid valve, into the left ventricle. From that left ventricle on systole, it pumps out through the aortic valve to the aorta, ascending aorta, aortic arch, and out to the body. Know the blood flow through the heart and all those wonderful valves and things. You'll see it again on a test. And then Poiseuille's law, that's your homework. Look it up and associate it with blood flow through the heart. And why is this law important? We'll talk about it in class. Have fun looking it up and reading it in your book. All right, the coronary arteries start in the ascending aorta on the left and right side. So just above the leaflets of that aortic valve. The left coronary artery supplies blood to the left ventricle, the septum, part of the right ventricle, and part of the heart's conduction system. The two branches of the right coronary artery are the anterior descending, and the circumflex. The circumflex circles around to the lateral aspect of the heart. So left coronary arteries, you got the anterior descending, that goes down in front, and the circumflex that circles around to the lateral aspect of the heart. Next is how the heart gets blood itself. There's a right and left coronary artery. The right coronary artery has two branches. It supplies blood to the right atrium, right ventricles, and a part of the conduction system. The two branches, and you can see it right here, right coronary artery comes right off that ascending aorta. Two branches of the right coronary artery are the posterior descending, and the marginal branch. The marginal branch takes care of the more frontal part of that right ventricle. And the posterior descending, the one that goes down into the back, is pretty self-explanatory. Posterior descending, down into the back, marginal branch, the front margin of the right ventricle. The right coronary artery empties directly into the right atrium by way of some small cardiac veins, and both coronary vessels, right and left coronary arteries, receive blood flow during diastole. You got the squeeze, pushes up, blood up the ascending aorta, and then in diastole, when things relax and blood comes back down, it rushes into those coronary arteries. Blood drains from the left coronary artery via the great cardiac vein and the lateral marginal. We got great cardiac veins and the lateral marginal veins. Veins empty into the coronary sinuses. Anastomosis. Anastomosis. Remember this. Anastomosis among various branches of the coronary arteries allows for collateral circulation. Sort of like the circle of Willis in the brain. The brain can always get blood if one artery is blocked. The same thing happens in the heart, and that's via anastomosis. Anna and Moses walk hand in hand. They keep collateral blood flow and circulation moving. Anastomosis. I've said that 4 or 5 times, so it's probably a test question. Anastomosis. Hey, and here's our coronary arteries again. Let's review. We have our right coronary artery and left coronary arteries. They come out right above the leaflets of the aortic valve. The branches of the right coronary artery are the posterior descending, the one that goes down into the back, and the marginal branch, which takes care of sending blood to this margin of the right ventricle. Then we have the left coronary artery. It supplies blood to that area down in front or anterior descending and to the circumflex. The circumflex branch does that lateral side, circles around the side and takes care of that lateral aspect of the left ventricle. So remember, your two main branches of the right are posterior descending and marginal branches. The two main branches of the left are the anterior descending and the circumflex. You'll see it again. All right, folks, time for a bad joke. You can tune a guitar, but you can't tune a fish. Ba-dum-bump. No, doggone it. We're talking about the structures of the vessels in your body. And they have 3 layers, and they are the tunicas. The interior layer is the tunica intima. The middle muscle layer, sun's out, guns out, is the tunica media, and the tunica adventitia is the outer, tougher layer of your vessels. Remember that the muscle layer is the reason our vessels can vasoconstrict and vasodilate. All right, the arterial system carries that oxygenated blood that went from our pulmonary arteries to our pulmonary veins to our heart and to the aorta. So the arterial system is under high pressure. As the pipes get smaller, the arterioles, they control the blood flow with that vasoconstriction and vasodilation. The arterial system terminates at the capillary level where that gas exchange takes place. Remember, at the capillary level, the red blood cells go through the capillaries in a single file. So you can see the area. We've got ascending aorta from the left ventricle, the aortic arch, descending aorta, thoracic aorta, abdominal aorta. Then you get to the arteries, the arterioles, where vasodilation, vasoconstriction occur, and then the capillaries, single file RBCs, and oxygen and gas exchange occur in the capillaries. All right, from the capillaries, the blood hits the venous system, which transports that blood from the tissues back to the heart. The venous system is low pressure, a low pressure system. It works via muscle contraction and valves. Like I said, it comes from the capillaries to the venules, to the veins, and then the vena cava. Muscle movement and valves is what transports our blood back to our heart. Blue blood, unoxygenated blood, moves up the veins during the contraction or systole of the heart. When it stops contracting, the diastole, blood flows back and gets caught in these valves, and the process starts over. The heart pumps blood up, we're in diastole, it sinks back down, and moves all the way to the back of the heart. With varicose veins, these valves are broken. If you've ever seen the legs of a person with varicose veins, the veins will actually start to snake like a winding country road to make up for the valves being broken. Venous system, low pressure. Big take-home message there. All right, in summary, everybody likes that slide, but instead we got the review. You need to be able to trace a drop of blood through the heart, the chambers, the valves, out of the heart to the arteries, through the body, and back through the veins and the vena cava, because you'll see that again on a test. You need to know where to find your point of maximum impulse, S1, S2, S3, and S4. Those are very important to know where to listen and what they sound like, so you can tell the difference between normal and abnormal heart tones. Also, we will have time in our face-to-face lab with heart models for you to identify the landmarks in the heart. And then that will be a part of a test later on. I hope you enjoyed the presentation. Have a good day.